this exercise is going to be an unconventional way to use your back extension machine. You're going to want to make sure that this is set up like just above your hips. We don't want it too high unless you are targeting a certain part of your spine. So if you want to target more of your upper back, you can make this a little bit taller. So the taller you go with the actual machine, the more you're only gonna move your upper back, which is totally fine if that's your goal. But if you are doing this and it's new and we're trying to get your full spine, you want it lower, you're gonna go ahead and get into the machine like we normally would, except when we go down, we are not just going to hinge at the hips, which is fine if that's the way that you're doing the exercise, but this is going to be spine segmentation. So we are actually targeting the entire spine, not just your lower part where your hips and pelvis are. So we are going to cross our arms across our chest, and we are going to start rounding our neck and our upper back one segment at a time. We're gonna curl down as far as we can. When we can't go anymore, we're then going to reverse, starting with our heads and upper backs first. So you're gonna move into extension. You're thinking about scooping your chest up and forwards. You're lifting one segment at a time, as high as you can, back to the start position. Now the key here is we want every single joint doing work. This is progressed. So if you feel like you skip parts or there's chunks of your spine moving together, it's totally fine if your goal is to just load your spine, but you might need to regress if this causes any pain or anything like that. So you're gonna do that for the prescribed amount of time or reps, depending on what's on your program. If you've been doing this for a while and you wanna make it harder, you can either attach a band here and your elbows and wrap it around your elbows, or we can grab a dumbbell, a kettlebell, or a med ball and hold it here to make it a little bit more challenging. But that's how we're going to progress it. So make sure you start slowly, give yourself some time. Try to get every little segment to talk to you, or try to talk to every segment as you're doing it. And then eventually you'll want to make sure you're progressing, and you'll really feel a lot of your entire spine muscles working really hard with this. So progress slowly.